Okay, welcome and good evening. My name is John Nickens. I'm the president and CEO of Children's Hospital, and it is my absolute privilege to welcome you tonight to our virtual launch of ThriveKids, the Student Wellness Project. Tonight we're greeting you from Langston Hughes Academy, a member of the First Line Schools, proud member of the NOLA Public Schools family, and on behalf of Children's Hospital, thank you, Langston Hughes, for hosting us and allowing us to kick off this great event tonight. To those of you joining us via live stream, we're thrilled to have you, and pay attention to some great speakers and really the theme of how we're going to impact our ideas, our thoughts relative to the physical and mental well-being of kids. You know, as pediatric healthcare providers, this idea is the health experts for kids working with educational experts to make a difference, to be aspirational, if not maybe change a generation. And today that's necessary. The children of Louisiana are experiencing some of the worst child health outcomes in the country, and that just doesn't align with my experience going across the state of Louisiana and meeting the people and the culture of Louisiana. We feel like we can do better. And with this partnership, this idea of pediatric health care and school educators coming together, what could we accomplish? Well, tonight we're excited to share with you some of those innovative ideas, some of the school-based health services, and it's my privilege to announce on behalf of the Board of Trustees of Children's Hospital, our chairman of the board, Dr. Stephen Hales, our LCMC parent health system, Greg Fern, that Children's Hospital is dedicating $5 million to focus on the idea of our allocated resources. Thank you. So we're going to take $5 million of our resources and commit it to ThriveKids. We're also going to set aside $2.5 million of cash that will be matching funds for any business, any donor, any foundation that would like to join us in this investment. So 5 plus 2.5 plus 2.5, Children's Hospital is committed to a $10 million commitment investing in the future of kids. You have some pretty cool speakers tonight. We're going to start off with Lieutenant Governor Billy Nungesser. He's going to come up, talk for a few minutes. Apparently we've got another tropical storm coming in. This is number 7 we've prepared for at the hospital. He has some responsibilities, and we'll be heading out for that. But you're going to love, if you've not heard the Lieutenant Governor speak, you're going to love this. I heard him speak at Special Olympics event. You can just hear and feel his passion for the state of Louisiana, his love for the people of Louisiana. By the time he got done speaking, I was like, I'm so proud to be from Louisiana. And you're going to feel that same way. Then we're going to hear from Dr. Cade Brumley. This is a visionary educator. I've had the opportunity to tune in to some of his webinars and watch his ability to create a vision among many disparate ways of thinking and say, hey guys, I'm going to challenge you, I'm going to push, I'm going to love, but we're going to do the right thing for kids every single time. And it has been powerful to watch that. I admire it. We get to hear from Emily Wolf. Emily is this unique ability to navigate the craziness of city politics, yet stay focused on the practical nature of serving our youth and families. And I'm certainly always proud to be around Emily and see the work that she's doing that's real and measurable for the city of New Orleans. I also want to say thank you to many of our ThriveKids leaders who are here and other leaders from NOLA Public Schools. Thank you for joining us tonight. We think this is a big deal as we focus to advancing student wellness. And to us, that means ensuring easy access to health care, a robust investment in education, and dedicating our resources in a way that is inspirational. We believe all children should have the opportunity and deserve the opportunity to grow up healthy and thrive. Not just survive, but thrive. We go further to say that if we're really going to make a difference generationally, we believe this is the right time, Louisiana is the right place, and Children's Hospital is making this a top priority If you want to change the health of a generation, it only makes sense to start with schools. And so we're proud to be here tonight to kick off this event, this project for us. I'll now turn it over to Natasha. Natasha is our vice president at Children's Hospital. She's a New Orleanian, been at Children's Hospital for 20 years. She's also our executive over diversity and inclusion. I'm incredibly proud of the work that she is doing. Tonight, she's going to serve a unique role as our MC, which keeps us on track and manages time. We want to be respectful of your time. And as I transition, Natasha, I would just like it to go in the permanent record that I stayed within my minutes. Okay. Thank you for being here. Please welcome Natasha.
Thank you, John. I am really excited about that announcement and actually would like to ask for another round of applause. That $10 million commitment is amazing. Thank you again to everyone joining us from home. Before we get started, we are going to start off by viewing a short video. So if you take a few moments to view this video with me.
At Children's Hospital New Orleans, we're committed to healing sick children. But it's more than that. It's the idea of getting outside of the hospital and creating environments of health. It's the idea that we can change a generation. Health outcomes today for the kids of Louisiana aren't great, and we want to be a part of the solution. That's what ThriveKids is all about. Children's Hospital is making a significant investment into school wellness. This is an opportunity and an honor for us to partner and work with schools across the state of Louisiana.
ThriveKids is a program that optimizes each school's needs for their children, and really it's to promote the mental and physical well-being for each kid within that system. We're trying to do this in an engaging and innovative way so that they really buy in to their overall well-being as well.
By connecting our pediatric health experts, as well as our Louisiana educational experts, we are ensuring a healthier future for our children. ThriveKids provides school-based virtual care, mental and behavioral health services, sports medicine, chronic condition management, a dedicated nurse hotline for school wellness and virtual care, and education and resources for schools. We will also be there for our schools when the unexpected happens. During the COVID-19 pandemic, we partnered with the Louisiana Department of Education and schools across the state to ensure that both the students and our educators had what they needed to safely return to school.
Collaboration between our education and healthcare communities with a shared vision to help all our students thrive, it's critical. In some of our communities where services like medical and behavioral health care may be difficult to access, students and families will benefit from this type of partnership to best reach our kids where they are in our schools.
It's really important that we bring healthcare services into the school setting because attendance. Our kids need to be in school as much as possible. Having that access to services in the schools can really significantly improve students' attendance, and ultimately that improves their long-term outcomes academically. Children's has also been a great partner in providing physicals for sports, getting our kids a quicker access to the proper care that they need.
Children's Hospital has been the resource I never knew I needed. Their ability to answer our questions, connect with our medical advisors, help guide our procedures, and just knowing that I have a resource has given me, and I know my leadership, a lot of peace of mind as well.
As a mom and a pediatrician, I'm inspired by the progress we are making together with our school partners to advance the health of our students in Louisiana.
We can make a generational change for not only the schools but the kids, and hopefully that'll continue their health education and their health care and their emphasis on themselves later in their lives.
Bringing services directly to schools will help all of our young people have the opportunities to learn and grow and be healthy.
Working with schools across the state of Louisiana, the future is bright for our next generation. This is how we can be extraordinary together. ThriveKids, the student wellness project by Children's Hospital,
join me in welcoming Lieutenant Governor Billy Nungesser. We are so honored to have you with us today. Thank you.
Thank you. Wow. You know, John, I wouldn't expect it anything less. After touring the facility, seeing the love and passion your team has every day at that hospital, this is pretty incredible. You know, it's special to me because I wasn't always in politics. As a matter of fact, I rode out Katrina 14 miles from the eye. I don't recommend it because me and my wife had a riding center for special needs children that serviced over 200 children and adults with special needs at no cost to them or their family. I saw miracles happen on that horseback. Greatest thing I've ever done with my life. But I rode out the storm to protect those specially trained horses and grew frustrated after Katrina for the lack of response, and today here I am. This is an incredible program that is so needed. We developed under the Lieutenant Governor's Office, Uniquely Louisiana, that's downloaded to teach kids about schools, things in the state, and then Homework Louisiana. And in this COVID-19, we saw the usage go up 800%. But to provide this for health for these children, I'm just blown away. So tonight, I'm on a time limit, but I'm here to welcome you. I'm asking you to get involved. Me and my wife will commit $5,000 to the match, and I will be here. I will be here till we raise the whole match and helping the hospital reach their goal. This is an incredible program by incredible people. Thank all of you that are involved, and God bless you.
Thank you so much, Lieutenant Governor, and thank you for being with us this evening. Stay safe. With that, we are going to have our very first drawing. So this evening, we are going to draw for a $25 Amazon gift card. So, drum roll. All right, the first winner is Dominic Palmisano. Dominic, you are the winner of a $25 Amazon gift card. Congratulations. Stay tuned for 2 more drawings to be held throughout the program. Now, I would like to welcome Dr. Mary Lindell, our Service Line Chief for Behavioral Health at Children's Hospital. Dr. Dell, the floor is yours.
Thank you. It's so good to be here, and this entire effort, Thrive, is so vitally important. I stand here as the granddaughter of a woman who taught the 4th grade for years and years and years. My father was an elementary school science teacher and taught driver's ed in the summer. But even more importantly, we cannot leave out the school nurses. After my youngest brother went back to school, the same brother that was born in the middle of report card time, so all the teachers know what that means. My mother was a school nurse, went back to school nursing. As I tell people, I am a disappointment to my mother because I am not a school nurse. So that to say, you're going to hear some wonderful things from the experts who work side by side from psychiatry, psychology, behavioral health, who work side by side and interface on a daily basis with the teachers here in New Orleans and all of Louisiana. What I would be remiss to say is that even as all our teachers and our school nurses and the custodial staff, the school lunch people, even as you are all working with these kids and know our children and see firsthand the first signs that something's a little amiss, remember that the best thing that you can do in the schools, that we can even do, in the hospitals or wherever healthcare providers work, the best thing that we can do is to take good care of ourselves. And whatever form that takes, physically, emotionally, spiritually. Even as you are the wings beneath the work of the child, look for those little ways. That is not being selfish. It is not taking time away from your mission. It will only augment it. Thanks for being here.
Thank you, Dr. Dell. Those are some really important words and some things that we absolutely can remember. We appreciate you sharing your expertise. Thank you. Now it's my honor to welcome our keynote speaker, Dr. Kate Brumley, who is the superintendent for the Louisiana Department of Education. Dr. Brumley.
So please accept my apologies for not having prepared remarks tonight. So instead of offering prepared remarks, I'll tell you what I know. What I know is that in March of this year, the governor, rightfully so, closed our school buildings. And it was a time of uncertainty for so many of us educators across the state. It was a time when we could have stopped, we could have quit, we could have said, you know, we can't do this. But instead of that, educators did what educators do. We found a way. And over the course of time, whether it was providing meals to students who needed it, helping provide health care for kids who needed it, making sure that students had learning packets, or making sure that opportunities were available to students online, educators did what educators do. And over the last roughly 8 months, we've improved, and we've gotten better, and we've gotten better. And we've only been able to do that because we've been able to enlist great partnerships with organizations like Children's, with many of the doctors, pediatricians on staff here. Educators across the state are experts in what they do, but we were never, nor did we ever say that we were experts on this virus. And so we needed help, and we needed support. And we got that and have received that in abundance, and for that I am so thankful. And that is the reason why I agreed to be here tonight, because when Children's asked me to be here, Children's has been by our side from day one, helping us through this. And our educators, both our teachers, our leaders, our school nurses, our bus drivers, our cafeteria workers, everyone that's a certified educator or a staff member has been working to mitigate this virus in our school system. And what I believe to be true, and what I know to be true, is that our approach statewide, whether you've been in a rural system or a suburban system or an urban system, has been the right approach. It's been a measured approach. It's balanced first the responsibility of keeping all of our kids and employees safe, along with improving and making sure that we find a way to educate kids through this. Now, will we have some degree of setbacks? Yeah, we will, but we'll persevere. We'll get through this. We'll find a way, because again, that's what educators do. When I think about the massive problems that the global health pandemic has caused, it can be overwhelming. But I choose for my glass to be half full, and I think of some of the silver linings that will come or have come from this unfortunate set of events. One of those is just the increase of technology throughout our society, throughout our school system, in a positive way. At the school level, I think about parents being able to exercise more choice in the modality of instruction that they choose for their children moving forward. And beyond that, I think about what is important here tonight is the relationships, or are the relationships that have been fostered between medical providers, between individuals in the social and mental health communities, where those partnerships are alive and they're real in our school buildings and with our educators. And those things are not going to go away. Those relationships and those connections are important, and we believe that beyond this pandemic, post-pandemic, and I say that because I believe we will be there, those relationships, those connections will remain intact, and they will be positive for our kids. You see, whenever you look at rankings of our kids compared to rankings of kids from throughout America, you see that our kids aren't where we know that they need to be. And we know that our kids are as smart as kids across this entire country. But we know that they also have some additional barriers. We know that they have some additional challenges, but we choose to call those opportunities. And we're going to accept those opportunities, and we're going to get the kids what they need. We're going to get our educators what they need through partnerships such as Thrive, through partnerships with organizations like Children's. And we believe that our kids will get better, through the work of their educators and their partners in the educational space. And so I'm thankful that you've invited me here for this evening. I'm thankful for the work that you have done, and I'm thankful for the work that we will all do together to make sure that our kids get an education that they deserve in a safe way. So thank you for having me tonight.
Thank you, Dr. Brumley. Such inspiring words. I mean, that was really motivating. I really appreciate you being here, and thank you for those words. Speaking of partners, it is my honor to introduce Emily Wolf, who is the Director of the Office of Youth and Families for the City of New Orleans. Emily has been a great partner throughout this entire process. So Emily, the floor is yours.
Right. Thank you so much. I'm thrilled to be here on behalf of the mayor and bring greetings. I want to first thank and congratulate Children's Hospital, and specifically John, who has been an incredible partner of the administration's. I remember sitting in the mayor's office with her when we met with John when he had first gotten started, and just being so excited about all of the opportunities on the horizon. You have truly hit the ground running and have put your money where your mouth is. And you've really led the hospital to be a strong partner to the community, which is something that the mayor, said right off the bat. We really want Children's Hospital to be a part of this vision that we're creating to make a child-centered city. And you have been that partner, so thank you. I also, of course, want to thank Langston Hughes, NOLA Public Schools, and Dr. Brumley for the enormous task that you've taken on to guide our students, our families, our educators, and our school leaders through this new and challenging chapter of delivering instruction during a pandemic. Despite the doom and gloom of the past several months, we have seen so many exciting examples of innovation and collaboration across sectors, which is what you talked about, Dr. Brumley. And ThriveKids is truly an example of this. Child well-being is of the utmost importance to our mayor. Our mayor believes that children are our city's greatest asset, and their well-being is the clearest measure of the health of our entire community. One of the mayor's first actions when she took office was to create the Mayor's Office of Youth and Families. And for myself, as the leader of that office, our work is centered around creating systems-level change for vulnerable youth and families by encouraging our child-serving agencies to break out of their silos and to work together, because we really do not have time. We do not have time to waste. And so we've worked closely with many of you here tonight to solve and to create solutions around some of our most pressing challenges. And this is both pre and post-COVID. That's ranged from our partnership with Children's to deliver primary care and behavioral health services at the Juvenile Justice Intervention Center, to our collaboration with NOLA Public Schools to guarantee that families, again, would have access to meals during the pandemic and ensure a safe reopening for all of our students in the city. We know that COVID-19 has taken a toll not only on our students' physical well-being, but their mental wellness as well. Parents and students are frustrated, overwhelmed, feeling isolated. But that's why we can't say enough about the value of this initiative. The full range of support that you're going to hear more about tonight, from the virtual doctor visits to mental health services, the support for our school nurses and for sports medicine consultations, all of that are essential tools in our toolbox. And the strategy of reaching children where they are, reaching families where they are, is absolutely aligned with the strategy and the vision that Mayor Cantrell has painted around making a city that is child-centered and that really puts children first. So just know that we stand ready to continue to support you and work with all of you as educators, as leaders in the health sector, in order to ensure that all of our students and families stay well, grow up healthy, and thrive. Thank you.
Thank you, Emily. Now I'd like to draw our second prize winner for this evening. We have Allison McCallum. You have also won a $25 Amazon gift card. Congratulations, Allison. Now we're going to be moving to our second portion of the program, a Q&A panel with experts in both child health and education to answer your questions. I'd like to introduce Jonathan Brooke, the Chief Operating Officer for Children's Hospital, who will be moderating the Q&A panel.
All right, thank you, Natasha. It's my privilege to have the opportunity to moderate this panel for us tonight. As we get started, we're going to take a short break, play a quick game of musical chairs, and get our panelists set. So for those of you joining us on the live stream, hang tight for just about 2 minutes, and we'll get started with the Q&A shortly.
We were going to do Q&A for a second. Thank you. That was awesome. Good job. You have a wonderful presence. I love your tools in the toolbox. Yeah, you got that. Good job.
All right, welcome back, everyone. As we get started, I want to go ahead and do some quick introductions of our esteemed panelists this evening. Maybe if you can do a quick wave to the camera as I call your name. First, we have Dr. Tony Gonzalez, who's our School Wellness Medical Director, Children's Hospital New Orleans. Dr. Denise Carute, one of our pediatricians at Children's Hospital. David Gamble, Sports Medicine Manager, Children's Hospital. Dr. Dan Waldman, a pediatric psychiatrist at Children's. Patrice Wright, educator and co-manager of the Parenting Center at Children's. Tiffany Delcourt, Chief Operating Officer at NOLA Public Schools. Venus Parker, who's a nurse and a health services facilitator for NOLA Public Schools. And LaCandace Johnson, who's a teacher right here at Langston Hughes Academy. All right, thank you guys so much. Maybe a quick round of applause. All right, Dr. Gonzalez, we're going to jump right in. I want to start with you. I know school wellness is something you've been really passionate about. You've been sort of an architect of the ThriveKids program. Tell us a little bit more about what we can expect with the ThriveKids program.
The ThriveKids program is very important to all of us, and really it's a collaboration between all the influencers in a child's life. It's an opportunity to collaborate together, to come up with a plan to inspire kids, to guide kids, and really optimize their performance within the school. We'd like to take all the influencers in the child's life, the school influencers, the medical influencers, and the home influencers, and really get together with them and come up with a collaborative plan that all those people can get behind and move forward as a unit. Before, we had several people with plans all moving separately together, and just as a group, we'll do so much more if we move together as a group. With that, we want to utilize the platforms at Children's Hospital to remove barriers to our kids. We want to use virtual care, both primary care and specialty, so that kids can have an opportunity to get their health visits to school. Parents have an opportunity to stay at work. In our rural settings, people don't have to travel as far. It will remove barriers to kids so they can get the care they need. Also, the schools can collaborate with the caretakers or the physicians to implement a plan that they can optimize and make specific for that situation. We also want to support nurses, provide education for both the nurses and the students so they can be engaged and feel like they're a part of this process. We want to optimize the behavioral health and consult the behavioral health so that we can adjust curriculum so that behavioral health is no longer a barrier in a kid's outcome. We want to utilize our sports medicine programs so that kids can perform to their best both in the school and on the field, and we can take care of minor issues as they come up and get them back as quickly as possible. We also want to eventually get possibly in-school and after-school programs so we can optimize the kids' education as well, and so it can be an entire group. We really believe that through this collaborative effort, we can move forward. As a group, we can get kids to where they need to be. We can help them thrive in school, and eventually if we can get them to thrive in school, they'll thrive at home, and they'll thrive in the future.
Wonderful, thank you. Yeah, I think your comments about collaboration really resonate when we start to go down the list of, it's quite a variety of services, school-based virtual care, mental and behavioral health services, sports medicine, COVID-19 support, an incredible breadth of offerings. And I see on here if folks want more information, they can visit the Children's Hospital website or send an email to ThriveKids@lcmchealth.org. Tiffany, continuing on this trend, you've been such a great partner for Children's Hospital as we've launched this effort. We were talking earlier this evening about sort of the variety of challenges that we face every day in a school setting related to COVID-19, healthcare, and beyond. Could you tell us a little bit more about what you consider some of the biggest health and wellness challenges students are facing today?
Yeah, sure. Thank you, Jonathan. So I think COVID really shined a big bright light on some of the access to healthcare issues our children have always had. And it's really made them very obvious what those issues are. And we say access to healthcare, and it sounds so obvious, but what we've really realized is it's access to healthcare because you don't have reliable transportation. It's issues because you don't always have a trust with a healthcare system. You don't have a relationship with a healthcare agency. There's lots of factors. And I think what we've been doing is working with children to figure out how do we build bridges around those issues of access. And I think, speaking about how do we find bright spots in all of this is how do we make those bridges long term, and I really think that's the purpose of Thrive. And I'm really hopeful and thankful for that because I think we now know things. We know about those issues. We also know, hopefully, how to fix them, and that we fix them not just for a pandemic, but for all the health and wellness issues our students are experiencing at school.
Thank you, very well said. Dr. Karut, we had one question come in, and folks wanted to know more about the medical care offerings at school. I know you've been a big part of getting some of our virtual care services launched. Can you tell us a little bit more about how that works and what it looks like to access care from school?
Sure, I'd be happy to. It's something that I feel very passionate about. I'm born and raised right here at Toro Hospital and lived here my whole life. And I trained at Charity Hospital and Children's Hospital for my medical training, and I saw a lot of need in our city. And I'm passionate about serving the children of Louisiana where they are in school every day. And I think that this is a great partnership for Children's Hospital to make with our schools and with our children all over the state. The way it works is really simple. It's amazing the technology has come so far that the schools who are partnered with us, the nurse picks up the phone, she gives us a call, she sees me on the screen, I get to see her and the cute kids, and we have a lot of fun. It's really a pleasurable experience. The kids love it. They perk up and get so excited when they see me on the screen. It's so sort of high tech to them, and to me too. And so we have fun. I get to assess whatever's wrong with them that day. It's great for dealing with simple things like pink eye and rashes and basic things like that. But it's also good for chronic illnesses too. Kids who have asthma, diabetes, cystic fibrosis. We can manage a lot of their symptoms on a daily basis at school through this platform as well. And it's very rewarding to help them, and their parents can be in on the call if they want to, or if they're too busy at work. Most of them are fine with just accessing their records through MyChart in our electronic health record. It makes it really easy for them to see what we did, what our plan is. I can send the prescriptions directly to the pharmacy for them, so they don't have to make another appointment at a clinic that day and miss work for the afternoon or the next day. And they get the prescriptions they need, and the kids oftentimes can go back to class, or they'll be back the next day, as opposed to having to miss a lot of school. So it improves the access dramatically for these children. And like Tiffany mentioned, transportation can be difficult for some families, and so it really helps in that situation as well. And the other part that I really like is being able to support our school nurses, because they are the Army out on the front lines every day in those schools. And I love dealing with them, working together with them, being a team. It's so exciting. And they can call me anytime, any questions. I'm happy to help and give them our support.
How about a round of applause for our school nurses? I think they deserve it. Now, Venus, as a health services facilitator at the schools, you're really on the front lines. So tell us, sort of from your perspective, what some of the challenges you see schools facing today, and maybe why you're excited about some of the potential that ThriveKids has to offer.
I think a lot of people have the idea that school nurses just take care of kids who have problems during the school day who become sick or manage medical emergencies. And actually, school nurses do a whole lot more than that. They manage chronic health issues, they administer medications, check on immunizations, do vision and hearing screenings, other screenings. They complete lots of documentation, reports to the state, Medicaid billing. There's just lots to do. And now that COVID-19 is here, there's much more to do. We're monitoring staff and students for symptoms. We're contact tracing, arranging testing, reporting to authorities, reporting to family members, to staff. I could go on and on, but I'll stop there. Some of the challenges, finding enough time to do all the things that we need to do in a day. It's nearly impossible. School nurses right now, I hear from a lot of them early morning, late evenings, weekends. The job doesn't end. Most school nurses don't have a lot of help at their sites, and if they do have help, it's not from healthcare professionals usually. And sometimes it's just we don't know where to turn for help and who we can call on. And so having a partner who we can turn to and who can help meet our needs is essential.
Thank you so much for sharing. And, on behalf of all of us, I want to reiterate thank you for all you do to keep our kids healthy and well at school. Dr. Gonzalez and David, in addition to sort of the traditional medical care we've been talking about, ThriveKids also has some other sort of wraparound service components. Can you talk about some of those other wellness services outside of traditional medical care?
Well, the first one just relates back to the school nurses. We found during our help with the schools through the COVID response that they really were working hard. And because they were working so hard, we want to help them out. We want to support them. We want to give them space to breathe and take vacations and take time off as well. And through education, through that support, through being there for questions, we're developing a program at Children's Hospital to help support those school nurses. Should be coming out. We're developing it right now. It should be coming out over the next 3 to 6 months. And so please look forward to more information on that. Additionally, we do a sports medicine program at Children's Hospital, and I'll let David tell you more about that.
So for our sports medicine program, our team is composed of multiple individuals, but really at the heart of that program are about 30 athletic trainers, certified athletic trainers that work directly in numerous schools and recreational departments throughout the Southeast Louisiana. And they are there to provide great care, top quality care to all of the students at the school, not just the student athletes, but the students who participate in numerous activities, extracurriculars from band, cheerleading, sports, anything along those lines. Our athletic trainers are there to help those individuals stay on the field, stay on the band, and do the activities that they want to do, that they enjoy, that makes them unique and make them an individual. So that's really what our focus is. In addition to providing care in the schools, we take great pride in navigating our healthcare system at Children's Hospital and coordinating referrals through all the different specialties. So whether that's chronic cases and illnesses and diseases through all of our specialties, or dealing with athletic-related injuries and concussions, working together with all of our providers to provide that great care to get these kids back to the activity and keep them in school and minimize the time out of school, help their parents out to get them the needed care and the essential care for them. Another thing that my staff is involved greatly with is providing in-school physicals for pre-participation physicals for those extracurricular activities. And that has really been a great tool. We've uncovered numerous cases where we've identified some issues that the parents and the students were not aware that they had going on. We were able to get them into the appropriate provider and manage their care and come up with a good care plan for them to keep them as healthy as possible.
Thanks, David. I want to stay on that topic of healthy lifestyle for a minute and have a question for Dr. Karut and Patrice from the Parenting Center. I want to bring you in to the conversation as well. We hear so much today about helping students and really all people take ownership and control of their health. What are some things that our educators and parents can do to help empower our students to take ownership over their health, even at an early or young age?
So the Parenting Center is here to support parents, and we're out in the community talking about the importance of talking, reading, and singing to kids every day for language and brain development. In addition to that, one of the things that we've been working lately on is having parents recognize the importance of emotional intelligence, being able to recognize when they're upset, recognize when their kids are upset, and be able to know what to do from there. So to me, that's one of those biggies for us at the Parenting Center in helping to keep everyone safe and everyone well, being able to say, I'm frustrated, and not only say I'm frustrated, but say, give me 5, give me 10. That acknowledges the fact that you're upset, you need some time to calm down, and then you'll be a better person after you're in a better position, after you've calmed down. So a little bit of wellness tip from the Parenting Center.
Yeah, that's a good one. I think we could all use that advice of give me 5, give me 10 every now and again. So thank you. Dr. Karut, anything you'd like to add?
Yes, I'd also like to say that in addition to the Parenting Center, which is an excellent resource for our children here in New Orleans, we at Children's Hospital are passionate about health education in schools, and we look forward to partnering with the schools to improve their education about their nutrition and healthy lifestyles. And we're so excited to partner with everybody in things like the edible schoolyard that's right here on the campus. And we plan to do programs where the kids will work in their schoolyard, do a garden, and then harvest the vegetables, and then learn how to cook them so that they can learn about healthy nutrition and a healthy lifestyle and bring it home to their families and share it with them. And we also want to address things like food insecurity and the health disparities in our community and help them to partner with us so that we can make their life healthier. And we are open to suggestions from other people in the community. We'd like to partner with you in this area of nutrition and development for the kids. So reach out to us.
Great, thank you. Well, Candace, I know you've been doing some work with nutrition and excited about the edible schoolyard programs. Can you tell us a little bit about the importance of nutrition and that program from your perspective?
Yes. We have here an edible schoolyard, also known as ESY. Students are able to go out into the garden. We have animals back there, a pig, some chickens, some goats. Students are able to grow produce. Their favorite things to grow are strawberries. And they're excited to be able to come back and tell their teachers all about the different plants they learn about. They can tell you, oh, we can eat those leaves, but we can't eat those leaves. It's great. It's a great opportunity for them. I wish that was something I had when I was in school. And it also teaches a healthy alternative. Students get excited. They'll walk past and they'll pick a leaf and be like, oh, look, I can eat this leaf. So it's very important for them to learn early on about the healthy choices that they can make. And it's also awesome when they get to cook with the food that they planted. So it's a great opportunity and very educational.
Awesome, thank you. Dr. Waldman, in addition to the physical well-being, we of course need to continue to focus on mental well-being of children. Can you talk a little bit about what you and your team are doing to address the mental and behavioral health needs of kids at school?
Sure, Jonathan, thanks. And before talking specifically about the behavioral health aspects, I'd just like to kind of recognize and acknowledge the amazing stuff I'm hearing on the stage tonight. I used to be a high school teacher in New Orleans, and it's now been 10 years since I've been in the classroom, but school-based health and school-based behavioral health, mental health in particular, has since been like a huge passion of mine, and it's very exciting to be here tonight. And I'd like to kind of share a little story that hearing about ThriveKids has made me think about, kind of made me reflect on my time in the classroom. I worked at Opry Walker High School, which is on the West Bank, and there was an incredible school leader, Mary Laurie, and she would invite the new teachers down to meet with her before they started the school year. And she would go around the room and ask each of them, like, what are you doing here this year? And they'd go, and I think it caught some of the young teachers off guard, but they'd share like, oh, my name's Patty, I'm gonna be teaching 9th grade biology. My name's Michael, I'm gonna be teaching 10th grade math. And then at the end of going around the whole room, she'd look around at everyone and say, no, that's all wrong. You're teaching children. And when I think about kind of this initiative and this program, and I think about the work we're doing at Children's Hospital, it's just really aligned with that philosophy of thinking. I am lucky enough, I get to live and breathe that kind of thing every day, and there's so many people in the building at Children's Hospital that were in my classroom at Opry Walker, so the stakes are so high. These are our future colleagues that we're providing healthcare for, and to me, that's what this is about. It's about kind of meeting families and kids where they're at and investing in our community. So let me talk with y'all briefly about kind of the behavioral health aspect of this program we've really been working on. And I need some notes for this because there's so many folks that have been part of this initiative. It's just amazing how all this has kind of come together and that we're able to connect with the physical health aspects of this now too. So I'd like to acknowledge Dominique, who's been a real leader in all of this, and Cameron and Dr. Dell for supporting all this work. I think this in some ways started with an initiative from New Pathways, Peggy Mendoza and Ava Rogers, kind of guiding this development process and ensuring that the community stakeholders were involved in planning the behavioral health aspects of the work that we're going to be doing in schools. And also just the generous support from the MCK School Psychiatry Collaborative has been really important for piloting some of the behavioral health programs we have underway. So what is it that we're doing in schools? Well, as people have mentioned, a lot of it is just eliminating barriers to access right now, and we can do this in a number of ways. One is just assisting with the identification of behavioral health needs through universal screening. We've been doing a lot of consultation with schools in terms of looking at their data and trying to identify gaps in behavioral health services and figuring out how we as clinicians can best support them. We've started to provide some direct patient care in select schools, so we're doing some group therapy as well as individual therapy. And we've also started to do some psychiatric care as well, so doing psychiatric assessment and medication management for patients. We've been lucky enough to be able to involve our trainees. So now looking forward at the future of child psychiatrists in New Orleans, people are going to have the experience partnering and collaborating with schools, which I think is really powerful in our community.
Thanks, Dr. Waldman. That's a tremendous body of work. Staying with the behavioral health theme, but shifting gears just slightly, we know that through the COVID-19 pandemic, this whole idea of social distancing, et cetera, has introduced an entirely new set of stressors on our young people in our community. Can you talk a little bit about some of the things you're seeing related to mental and behavioral health from a COVID-19 perspective, and some of the things we can do to try to combat that?
Sure. So when I think about, it's so hard to capture how COVID-19 has affected everything. I think, to me, the big story of COVID-19 and its impact on health and mental health as well are just the health disparities across our country. And how does that translate for behavioral health? What I've seen is it's kind of exposed some unique vulnerabilities of our patient population and the fragility of the systems of care we have in place to serve these patients. I spend a lot of time in the emergency room, and we're seeing kids come in crisis, and COVID-19 these days is almost always a part of the story in some way. It's affected these crises in some way. On a positive note, I also see incredible resilience among the patients and families that we serve, and I am hopeful for that reason. If I could stress kind of 3 things that I think are super helpful, and it's interesting because to me these are all things that schools do so effectively. It's to offer support, socialization, and structure for kids. I think all kids benefit from those things, and I think that that's going to really help facilitate resilience among our kids.
Patrice, anything you want to add? I know you talked a little bit about the 5 and 10 coping technique, but I'm sure you're getting lots of questions from parents about ideas for the way kids can cope through this new reality.
Absolutely. We're making sure that parents are okay and understand that kids are out of sync. And so part of their responsibility as parents is to ensure that kids remain on some type of schedule. And even if they are not academically involved in something at that moment, they can still have time slots in the schedule throughout the day to have time for music, to have time for snacks, and to be able to do things that look school-like, but that's at home. And so what we're hoping through some of the messages that we're conveying to parents in some of the trainings that we're offering is that parents understand this is different, and what looks like something that is going to be easy to handle now is very difficult. It isn't easy at all, but we acknowledge that. And we are there to support our parents in a way to let them know we're here for you. And in order for your kids to be okay, you have to be okay. So I'm going back to that emotional intelligence, because many of our calls come in around parents just outright being frustrated about what's going on in the school. I'm a parent myself, and so there are times I have to stop and understand things are different. Our kids are different, but they are resilient. They will get through, but we have to always be there to help them get through. That looks different for many different families. So the calls we get are very different. You know, one might be calling about a schedule, someone else might be calling about a temper tantrum. But all of those things come together to play into the well-being of a child. And so no matter what the question is, we usually have an answer. And if we don't at that moment, we know where to go.
Thank you so much. LaCandace, you're a second grade teacher right here at Langston Hughes. I mean, tell us a little bit about, from your perspective, what it's been like to be back at school, some of the things you're seeing this fall.
Well, first off, we just have to acknowledge that when March came and schools were shut down, students' lives changed drastically. They went into an uncertainty. They went into a very structured situation as we did as best as we could to make virtual learning structured, but none of us had done it before. Not an educator, not a student, so it wasn't as structured as the classroom setting. Then to go from a classroom setting to a hybrid model. coming back into school, in a sense, it was, oh my goodness, wait, we're back to structure again. We had to reteach that structure, and as educators, we have to be patient right now because we're still reteaching. As the trimester changes, we have new students coming in. And one of the biggest things that I've noticed is students are concerned about the fact that they can't do what they used to do. Sharing is now, we've been telling them to share all of this time, and now it's like, wait, don't share that. Oh, I want to give my friend chips. I can't do that. And something that I talk to my students all the time for recess, something that they always tell me is, man, COVID changed recess, because now the things that they used to be able to do, they can't do anymore. Sharing papers in class or sharing manipulatives together and working with partners are things that they can't do anymore. And the biggest takeaway that I've noticed with students is they wonder, well, how come the rest of my class isn't here? Or how come I can't see my friends in the other second grade class? Because now recess is only with your classroom. So when you go out to car riders and they see their friends that they haven't seen all day, it's just like, oh my God, my friends. It's a very frustrating situation for them. So I think as an educator, the main thing for us to do is to make sure they know that we're there to talk to them and to make sure that it's structured as best as possible, because right now it's just an uncertainty, and they're young, they're kids. This is something they've never lived through before.
Absolutely, very well said. And again, thank you for all you do. We gave our nurses a shout out. I think we definitely want to give a round of applause for our teachers and educators. All right, Dr. Gonzalez, as we were receiving registration for tonight's events, we had several questions, as you can imagine, about COVID-19 and how Children's Hospital can plug in and help schools. You know, we have folks from all over the city and all over the state joining us on a live stream tonight. For folks who are looking for some more support returning to school safely, how can they get connected to Children's Hospital, and what can we offer?
Yeah, when this whole COVID pandemic hit, and then our opportunities to work with schools, we really wanted to do our best. And I think the same structure and consistency that kids desire, we desire too. And so as we were moving back, Children's really look forward to provide that consistency, to provide that guidance and structure. And so the team at Children's has really done a great job. They've created a great educational base through town halls and partnerships, both with NOLA Public Schools, with the LDOE. They gave town halls to principals and school administrators and teachers and nurses, and really over and over again, we just try to be available to answer any question we could. We then consolidated those onto our website for our frequently asked questions site, so anybody could look anytime to what, I had a question about this came up, I read this, and those were on the site that they could look at. Also, Dr. Finger, our quality control officer, set up an algorithm that the schools can go through. It really helped kind of streamline who needed to be tested, when to test, what the symptoms were, and that really helped a lot of schools through this process. We also set up a COVID hotline that they could call anytime if there was any questions, and mobile testing sites and in-house testing sites where kids, if they were just concerned or had symptoms, they could get tested and find out if they were affected or not. One of the things that really hit home for a lot of our schools is not every situation fit into that algorithm. And so we had access through the school wellness program to communicate with our physicians for all the one-offs. Hey, this doesn't quite fit in. Through the CDC recommendations, we were able to customize those recommendations for that specific situation and really get some insight back to our schools.
Great, thanks so much. And as we wrap up, any sort of final or closing thoughts you want to offer about ThriveKids or the initiative in general?
So as, you'll make me choke up for a little bit, because this is really important to me. I think that as a pediatric server, all of us here, we really bring kids to our hearts. We want to bring them in, and we want to give them the biggest opportunity to succeed in life. And this is what we all strive for. This is what the happiest time we see is when we take someone who has a barrier or a problem and really help them thrive. And that's what we're doing here. And that's what we really want to do and push us forward so that we can see every kid reach their potential, and that every kid can be the best of them.
Very well said, thank you. Well, that's just about all the time we have this evening. We had so many great questions that came in during the registration process. We, of course, didn't have a chance to answer them all tonight. We will be reaching out and making sure that everybody that submitted a question gets a response, so expect that after the event's over. Now I'll turn it back over to Natasha to continue the program. And in the meantime, how about a final round of applause for our panelists?
Thank you, Jonathan. As we're transitioning, the last piece of our program that I'm excited to announce is we're going to call Igel Gibbons and her son Blake to share their story of living with a chronic medical condition while being in a school setting.
Good evening. First and foremost, I want to thank y'all for allowing us to come and tell our story. Children's Hospital is very dear to our heart. He was diagnosed at 2, and they have been by our side throughout the whole thing. Not only they were by our side, but they included our nurse, our school nurse, and we also live in a parish who fortunately, he had his own personal nurse that followed him every day through school. So that only gave us a sense of, security that he had his own nurse that followed him, that Children's also allowed her to come to appointments with me and learn more about his diabetes and all. So it made him more comfortable with the fact that she knew his doctors also and his nurses, and they could communicate back and forth. So this program is, we need this. We need nurses in schools. We need that sense of comfort that if I'm at work, I have somebody there for him. And Children's has taught him so much about his diabetes that now he's at school teaching other teachers with kids with this diabetes. And she's asking him to come and talk to her son and train him with the pump and everything like that. So I'll let him talk a little bit about it.
Having a nurse really helped me out in school. I think every kid that has like a chronic disease like diabetes or something like that also needs someone to have a sense of comfort with them, so they know I'm comfortable with them, so I can know they know how to handle my stuff, and I could trust them with it. That helped me out trying to go through and learn how to do it. Having someone there that knew my mom and all my other nurses, and also had an idea of how everything that was going on with me, how they had an idea of how it went down and all that kind of stuff. That's all I gotta say.
So yes, we really support this. This is amazing. I think each and every one of y'all being involved, because it does mean a lot to have a nurse at school. Thank y'all so much.
Thank you, Igel, and thank you, Blake. Now, our final gift card winner for the evening is Annette Acamando. Annette, you are the final winner of a $25 gift card, so congratulations, Annette. Now, in closing, I see him standing right behind me. Join me in welcoming Dr. Stephen Hills, our beloved pediatrician and chair of our Children's Hospital Board, who's going to share some closing remarks with us. Dr. Hills.
I don't love to speak, but I love to take off my mask, so this is a nice opportunity. Thank you all for being here. John and your team, a very special evening. I was so pleased to see Dr. Brumley here and our Lieutenant Governor. They didn't come here tonight because of what we were going to promise to do. They came here tonight because of what you have done and the commitment you've made to the children of this community and this state. Dr. Finger, I'm looking at you. I think that's you behind that colorful mask. So much has been done, and we have so much more to do. I'm pleased to represent the Board of Trustees, both of the hospital and LCMC Health. We're very proud of this initiative, support it completely. see great possibilities here. This has been a year of incredible challenges. Certainly the pandemic has stretched and strained all of us in our hospitals, our clinics, and in our classrooms. We've had to confront, once again, issues of equity, particularly as they've been exposed in the areas of healthcare and education. These are zip code issues, and they shouldn't be. Access to an excellent school, access to excellent healthcare, these should not be determined by where a child lives, or where her parents work, or the color of her skin, or her family's income. But the pandemic has exposed, once again, the reality that access to excellent education and healthcare is not fairly, it's not equitably available to our children. Children's Hospital has, since its founding, provided a single high standard of care to all of our children, regardless of race or ability to pay or the zip code where they live. With the ThriveKids initiative, Children's Hospital brings that same commitment to equity out of our clinics and hospital and into the classrooms and hallways of our schools. We are not strangers to this work. It is what we do. But we are doubling down on that work. We're bringing all of our resources to where they are most needed. It's critically important work. Our children must have every opportunity to thrive. Thank you for joining us in making that a reality. Thank you.
Thank you all for joining us this evening. That concludes our program. You all enjoy your evening and be safe. Good night.